Hello, good afternoon. Salibonani, Makadi, Dumelang, Habari, Jambo, good morning, depending on where you're joining us from this afternoon. I'm excited on behalf of the Financing Alliance for Health to extend a warm welcome to everybody who is on the call today. My name is Zwila Sibindi, and I'm the Head of Operations and Risk at the Financing Alliance for Health. But more importantly, I'm your host today. I'm tuning in from Pretoria in South Africa this afternoon. I would like to get to know you as well. So please greet everyone in your own language via the chat box and tell us your name, the name of your organization, as well as where you are joining us from today. I welcome all of you this afternoon, and we are indeed excited to have you for our strategy launch. We have what we believe is an exciting program for today, where we will look at the journey of FAH over the years. We will have moments of reflection and looking back. We will hear from our partners, from Financing Alliance for Health staff. We will hear from the heart of the FAH leadership. And of course, the cherry on top will be the presentation of our new 5-year strategy as we look ahead. Please do interact with us during the session by dropping questions via the Q&A box, as well as interacting on our social media apps. The various social media links will be appearing on the chat box. Follow us, interact with us, ask questions, retweet, repost anything that will be coming through. And yes, I know more people are still joining. Please do let us know via the chat box where you're joining from, as well as your name. Welcome. Moving on with the program this afternoon, in the spirit of reflection and looking back, I will request your participation this afternoon. We have prepared what is called a Mentimeter and would like each person to answer the question, looking back at the year 2022, what is the one word that would best describe it for you? There's going to be a link right now for the Mentimeter in the chat box. Please click on it and go type in your one word that helps you to reflect on 2022. What is your one word for 2022? I'm also going into the Mentimeter right now to type in my word, and I hope everybody can access the Mentimeter. Challenging. I'm seeing the words coming through. Painful. Transformative. I love that. I love transformative. A bit tough, impactful, happy, exciting, joyful. This is amazing. I can see all the words coming through. Please keep bringing them in. Keep bringing them in. There's about 57 of us in the call right now, so I want to see at least 57 words coming through. Hopeful, crazy, I love crazy. Insightful, transitional, yeah, transitional, that's true. I can write a book about transition. Growth, exciting. I can still see the words coming through. Thank you so much for that. I want to see how our word cloud is going to look like when we are done with this. Grateful, opportunities, forward-looking. Thank you so much for that, and thank you to the tech team. It will be great to see the complete word cloud at the end of the session today, just to see how we have all coped with 2022. And I'm pretty sure that the words that we are putting in here are the words that are also setting the pace for us for 2023. If it was transitional, then I'm sure that you want to continue doing even greater things in 2023. If it was painful, I'm sure you would want to heal from whatever pain was going on in 2022. Thank you so much. Still in the spirit of reflection and looking back, the FAH team has put together a beautiful video that gives a brief history of our journey over the last 5 years. Please sit back and join us as we celebrate our 5-year journey. I will request the tech team to play the video now. Thank you.
We are working towards a world where leadership in global health is diverse, creating opportunities for the global south to have a voice, to shape and influence the services and policies that affect them. The problem that me and my team actually work towards is that healthcare is not accessible to everyone, especially high quality healthcare. Majority of the Africans in the continent, more than 50%, do not actually get the healthcare that they need. But the truth is, we actually have a $4.4 billion annual funding gap for community health systems at scale. And that is the gap that me and my team at the Financing Alliance for Health is trying to narrow.
In the last 5 years, the Financing Alliance for Health, in collaboration with other ecosystem players, has made great strides to address systemic health financing challenges. We have scaled community health systems and the delivery of quality integrated primary healthcare services through country, regional, and global partnerships. Despite systemic challenges, we have made incredible progress working with governments at different levels to tackle issues using a bottom-up approach. We have achieved the following. We have mobilized $0.5 billion to community health systems. Over 450,000 community health workers recognized in policy and programs. 6 community health strategies developed in 6 governments across 4 countries. 8 investment cases and policy briefs developed in 8 governments across 7 countries. 4,000 stakeholders trained and empowered on health financing and public finance management. We have also launched the Africa Frontline Fast Initiative Catalytic Fund that has mobilized at least $100 million with a current investment of $25 million from the private sector. The funds will scale up 200,000 community health workers in 10 African countries, reaching about 100 million people. In the same period, we have expanded our footprint in Africa, and we remain cognizant of the fact that our success depends on the quality of our people. The team is diverse, fun, committed, hardworking, and resilient. We value each member of the team.
In the next 5 years, I look forward to seeing African countries channeling funding to strengthen and scale their community health systems.
I'm so excited about the next 5-year strategy, and I look forward to us achieving much more as we strengthen and sustain our impact in developing community health systems.
In our next 5-year strategy, I look forward to FAH expanding its footprint on the African continent, collaborating or partnering with more institutions and with government to see that community health is prioritized and that community health workers are properly incentivized and institutionalized. And of course, more countries can now move a mile further towards universal health coverage.
I look forward to us taking up space and solidifying our position as a leader in the health financing sector, particularly in Africa.
We are excited about the future and look forward to partnering with you to strengthen and sustain community health systems and integrate primary health care to attain universal health coverage. Get to know about us and the impact we are having in changing the community health landscape as we seek to improve health for all.
Thank you so much, media team, for that amazing video, which truly captures the work that FAH has done in collaboration with our amazing partners. I want to underscore the word collaboration because it came out strongly in the video, that what we have done, we have not done alone. We have done because we've got the support and the anchoring of people who care about community health as much as we do. As we continue to look back, I would like to introduce the CEO of Financing Alliance for Health, Dr. Angela Gishaga, as we continue on this journey of self-reflection and introspection. She will share with us on our strides and impact in the last 5 years. Please put your virtual hands together for Dr. Angela Gishaga. Thank you.
Thanks, everyone. Thank you so much, Sizwile. Good morning, afternoon, and evening, everyone. As you've heard, my name is Angela, and I have been supporting this team as their leader since day one. And it's my distinct honor to share the strides that we've had in the past 5 years from day one of full-time operations. I just really want to thank everyone for making the time to spend your 1.5 hours with us today. I see our current and past team members on the call. Welcome. I see our clients. governments and community health workers on the call, thank you so much for joining us today in this momentous time that we are having. Our journey is who we are, and we cannot build on our successes. We don't reflect and celebrate them. FAH was launched in 2016 on the next slide and began full-time operations in 2017 from our global headquarters in Nairobi, Kenya. From day one, we made a commitment to grow a truly regional and a truly global institution that works on systems change throughout exclusively advising governments on health financing. Over the past 5 years, we've had and continue to grow our regional presence through expanding our geographical footprint to diverse countries across language and socio-economic strata on this continent. We have had different and changing levels of engagement across multiple countries, from light touch feasibility assessments in Burkina Faso and Haiti to full embedment across countries in West, East, and Southern Africa region. It has been an amazing journey, and we're really glad to have been able to learn from and support ministries of health, ministries of finance, and other line ministries on their primary and community health financing needs. As a team and as part of an ecosystem, we have advanced an impact within Africa and globally. As you've heard from Sizwile, we contributed to securing about $500 million towards community health on the continent, which provided economic opportunities for 450,000 community health workers on this continent. This has and continues to be a very collaborative effort. That said, we directly supported securing about $12 million on domestic budgets across our direct countries of support, which has been leveraged for payment of community health workers and also offering the supportive infrastructure required. Financing Alliance for Health originated, provided seed financial investment through CHAP support, and collaborated with Ecosystems Fastest to launch the Africa Frontline First initiative, whose goal is to transform the financing and optimize community health systems implementation at scale across 10 African countries, creating institutionalization and support for up to 200,000 community health workers on the continent by 2030. As always, in collaboration with partners who are also present on this call, Community Health Impact Coalition, Last Mile Health, Community Health Acceleration Partnership, the Skoll Foundation, J&J, the Global Fund for Malaria, TB, HIV, and AIDS, we successfully launched the Africa Frontline First Catalytic Fund and secured approximately $100 million to deploy in country so as to address the bottlenecks that retard community health systems from going to scale. Through our nuanced expertise in health financing and our embedments across multiple countries, we have access to primary government data. We have refined this data into insights and evidence, which we have shared with 4,000 stakeholders across 90 countries through our free online self-paced course that we did with Community Health Academy, as well as in-person training across various countries. We could not have done this without our most valuable resource, our people. Spread across the continent and across both our US 501c3 entity and our Kenyan entity, which is our global headquarters. I purpose to build a team that is grounded in the context, has lived experiences, and reflects the population we serve in Africa. And the population we serve on this continent is predominantly African, predominantly young, and predominantly female. I was intentional in achieving the 80% female, 80% young, and 80% African team so that we could create an organizational culture that supports Africans and people from the global south to thrive in global institutions. As we rebalance the team going forward, based on our diversity, equity, and inclusion policies, we will still predominantly recruit proximate leaders that reflect our core stakeholders who are our communities. the progress of FH could not have been possible without our global board that represents 5 out of the 7 continents across the world. Not only have they had fiduciary and legal oversight, they have been our friends, our thought partners, our co-creators, our champions, my counselors, and also people who have been really great in giving us the direction as an organization. I thank the team and the board and our partners so far. We would not exist if it wasn't for our holistic partners who have walked alongside us in this journey. A special shout out to the Community Health Acceleration Partnership for the initial seed in financial investment that created FAH and the ongoing bridge financing that was required in the very early years of our slogan. Thanks also for availing valuable resources such as Phyllis on our board, who continues to represent you and also your great leadership in creating the idea that we are honored to bring to life. Thanks to all the funding partners who believed, trusted, and invested in us. We have strived to do our best, even when we haven't always gotten it right. We thank you for being with us in this journey as we become and we improve. On this last slide, this is us. I celebrate the team, past and present, who have contributed to what FAH is today. From our second full-time equivalent team member, Harriet Napier, wherever you are, to our most recent joiner, Bildad Mwanga, it is by your contribution, hard work, dedication, sacrifice that we are who we are today. I pray that the experience of you being at FAH continues to be a worthwhile endeavor for you. Resilience has been our superpower, but our success hasn't been without costs and trade-offs. What got us here is not what will take us to the next level. As your leader, I must model a sustainable approach, and I'm on a learning journey, and I want to get better. Keep me honest. We have not arrived as an entity. We are still on our journey of becoming. Thus far, it has been Elohim Hayim. Asante Sana, thank you so much. And back to you in studio, Sizwile.
Thank you so much, Dr. Angela, for those warm words, amazing words, and really encouraging words. It's really, truly amazing to see where we have come from. As someone who only joined FAH in the last 1 year, I feel like I've been here from day one. And also it's very clear from the presentation that FAH has not walked the journey alone. All our achievements are because of the partnerships that we enjoy. And some really great figures are coming out from that presentation. The issue of diversity is coming out very strongly from that presentation. Diversity in geography and diversity in language. $0.5 billion forecast for community health systems. That is not child's play. And I really want to congratulate you, Dr. Angela, for leading us up to this very point. The other thing that was mentioned in your presentation is the online course where we have trained 4,000 stakeholders. And I would like to encourage everybody to check it out. The link is going to be dropped onto the chat box right about now. So you can go through that link, view the course, take the course, if it's something that is relevant for you. I really hope that we are going to see the numbers of the course going up after this session.